And we are live. Now, I already know that some of you are not going to like this live stream. I get it. I still love you. It's all good. But I just want to come on here and I want to talk about the facts. The facts of the data that is officially in here in the state of Ohio. Want to talk about the data, and I've got a guy who is a data expert, high level data expert that just was introduced to me by a mutual friend. We'll leave his name out of it. But I want to welcome my new buddy Brian Blackburn. Welcome, Brian.
Thanks, Ken. Appreciate it.
You ready to raise the roof?
I don't know about that, but we can chat a little bit here. Like you said, we've got some common friendships, and
we do.
Been asked to do this a few times over the last 7-8 weeks, and have resisted until tonight when our common friend, we'll say his first name is Mike. We'll just leave it at that. When Mike dialed us in together, and he got me talking, he's like, "You need to go on with Ken tonight," and I'm like, why don't you go, Mike? He's like, "No, you need to go." I'm like,
right.
Okay. All right. I like being the guy behind the curtain,
Right.
So
everybody does, man. But look, what's the I'm hearing myself again. That's weird. What is the saying? The only way for evil to win is for enough good men to do nothing, or something like that, right?
Yeah, stay silent. Yeah, I forgot who that quote was by, but I got friends out there that I could phone a friend and find out real fast for you. But yeah.
Yeah. Can you pull your camera down any?
Yeah.
Can you pull it down? There you go. So I don't want to cover your face with the comments.
Sure.
So a judge ruled on something today here in Ohio, and I felt that it was a really good idea to share this with the rest of the world, what this judge ruled on, and you have an opinion on it, and you have some well, quite honestly, man, I've never heard anybody speak the way that you did, really. I mean, because it was in such great detail with the data, and you're a data expert.
Something like that. When I showed up for work, I wasn't. And then one day somebody said that I was, and then they just say, "Fake it till you make it," right? So I've never been shy of a challenge or diving into something. And over the course of the last couple of months, I think a lot of us, we got a lot of time on our hands. So we've become junior epidemiologists and junior biologists and whatever ologies you can throw on the end of it.
Right.
But I do have about 10 years, almost 12 years actually, working in medical data. Was the manager of the data warehouse for Cardinal Health for years. And then over time, got a chance to build data and analytics solutions for folks like the Mayo Clinic, MD Anderson in Texas, University of Duke, University of Miami. So some folks that are, significant players in the healthcare arena. And being able to be on the inside of that did give me a perspective on what, at least from a national level, maybe not globally, but at least from a national level, what that kind of data looks like, and getting down to predicting, what doctors are using, what drugs. I guess I had to become a junior pharmacist at one point as well, and how long different doctors are using certain therapeutic treatments. And this patient A is in the bed for 2.3 days, and the guy over here is 2.5 days. What's funny is people would think that their doctors are making all the decisions on what drugs are being used, and a lot of times it's the guy that I was working with who was sitting in a cube, who's never seen the inside of a patient room or a pharmacy, but he's the one that's ordering all the, all the products. So,
wow.
I just came out of that world about 6 months ago. Otherwise, I probably wouldn't be on here doing this. I'd be heads down trying to help the cause. So trying to help the cause in a different way though right now.
So today a judge here in Ohio, and I'm going to pop the article up here on screen. A judge ordered Ergotron. I'm kidding. A judge. I don't know what the heck that's doing. Oh, it's an ad.
It's just an ad on the. Yeah, it's a.
An Ohio judge ruled to allow gyms here in Ohio to open immediately. And this article goes on to say that basically there's been a preliminary injunction filed, which effectively permits Ohio gyms to reopen immediately. It states that Dr. Is it Amy Acton? Is that her name?
Yeah, she's definitely well known.
Is she a doctor? Is she a real doctor?
She's a real doctor. Let's be gentle.
We checked her credentials.
Let's be gentle. Let's be kind. Yes, she's a real doctor. Yes, and we're gonna. My tone that I have tried to strike from day one about all of this is to assume positive intent, assume the best and motives, because people ask all the time, like, the why questions, and they're assuming some kind of deep state motives got to be behind everything. There's a conspiracy theory, and I don't think we need to go there to have a really intelligent conversation about the data, the facts, and the science. And you don't have to have a doctor behind your name to have common sense.
Well, right, and there's been I mean, look, for me, I'm not even close to a doctor, but I have a ton of common sense, and I have this internal radar guidance system that I've been like, man, something just feels wrong about all of this. Something just felt off from the beginning. Here's my favorite part of this article, by the way. It says constitutions are written to prevent governments from arbitrarily interfering in citizens' lives and businesses. On that front, the call to action is clear. The governor and health director may no longer impose their own closures and regulations and write their own criminal penalties to enforce those regulations and closures.
Yeah, we've gone well beyond the concept of a short-term quarantine, buy time for the protection of our healthcare system. And I think, that this is kind of commentary that's well documented now in certain circles. Unfortunately, it's become a partisan conversation. And that's one of the reasons why I haven't weighed in too much in a public way. And even my own personal Facebook page and posts, I've really dialed back in the last couple of weeks because I've watched this thing all shift into a partisan conversation. It really just needs to not be that, right? It's a science conversation. It's about health. And I think, up front, when you're calling for quarantines that, by Ohio code, it's if you're into code, it's RC 3701, and it's in that whole section of the Ohio Revised Code. This is a law that we have on the books that gives the healthcare director, great powers to be able to protect people when there's a communicable disease outbreak.
Yeah.
The context of that is not. When you go and you read it, it's very different than the way it's being applied right now, and it was never intended to come. I don't believe we weren't around when the thing was written, but you can kind of use common sense to kind of understand what the purposes of it were. So,
right.
It's definitely gone well beyond in many people's opinions, and now we finally have a legal ruling that comes alongside of what has been a growing opinion that we've kind of extended beyond that quarantine scenario where we don't really know what's going on. We got this thing, it's coming out of China. We got images on TV of people being locked down, and then someone says it works, and then it's in Italy. And then all of a sudden we see bodies being, loaded into the back of trucks, and it's horrifying, right? Northern Italy.
In China, you mean?
Well, then it goes into Italy, and you've got, these horrible images. By the way, my niece is in Sicily right now. So she was on house lockdown for over 40 days and could not literally step outside of her house. So, and then I had a nephew who's in Australia, and he got locked out. He got shut down over there. So, I got a grandmother who's in a nursing home. The day that the first order came out that stated that, nursing homes were going to be locked down, and I kind of saw what was going to come. The first post that I made in Facebook was like, okay, I understand this, but when am I going to see my grandmother again? When am I going to be able to touch her hand, give her a hug, actually see her again? And here we are 10 weeks later, and there still is no end to that particular question. It's coming up a lot right now, but yeah, being able to go out and make orders that go beyond quarantining sick people. And the law does say if you have been suspected to be exposed to that particular, it doesn't call it a virus, but whatever the particular health situation is, she does have the right to quarantine those folks as well. So there is some legal standing for her to quarantine what we would call the sick as well as the healthy. So there's been a lot of folks talking about how, oh, well, she can't quarantine the healthy. Well, if you've been exposed to it, there is this assumption that, okay, you might have it and therefore we're going to quarantine you. But what is also in the law, and that's what's very interesting about this ruling that came out today.
There's a friend of mine right there that has a similar story to you. She's up near in Akron, I think. Carrie, is that where you are? Akron, somewhere up there. She has a grandmother in a nursing home that was diagnosed with COVID last week.
Yeah, same as mine. Mine was diagnosed last week. We've been hopeful that she'd be able to come through this without any impacts, and was diagnosed last week. It was very, I'll use the word traumatic to the family to think, wow, she's been locked away for 10 weeks. Here we are. Within days, she could start having symptoms and be gone, and we may never see her again. Never,
Yeah.
So now my personal situation, and there's your friend Carrie. She says Canton. So yeah. And this is going on all over the state, and that's kind of it's not that I don't want to call it a dirty little secret, but it has been the facts and the data that I do know for a fact have been intentionally hidden.
And that's why I wanted you on. Yes.
Yeah.
That's why I wanted to do this with you.
Yeah. And now so why, right? The question's why? Why would they hide data, and what data were they hiding? Well, I can tell you for a fact, because I've got folks on the inside the State House that told me, when you look at the data, we're not going to bring the screen up now, but if anybody wants to go to the covidohio.gov site, you can see all this for yourself. And you go to the trends and the metrics that they put up, that they use every day to help people to know what's going on. The one piece of data that Dr. Acton and the team have enjoyed is the wrong word, I'm sorry, that have regularly presented to the people. I did not mean that as a slip. It just no one's enjoyed anything about this. I can assure you, right?
Well, I'm wondering how many times Dr. Acton has been on a television camera prior to this.
Yeah, right. There's a lot of coaching going on, I'm sure, and some of that's good. I mean, she needs to be a good, effective communicator. Let's not go there. But what I can tell you is that I haven't missed a press conference. It's not like must-see TV for me. It's just I wanted to be informed. I'm a data geek, and I wanted to see what story was being told with the data. So you can tell, anybody knows there's lies, damn lies, and then there's statistics. Everyone, has heard that phrase before, and you can tell just about any story you want to with statistics. I was actually talking to a reporter with the Dispatch yesterday, and I helped him to kind of think about how we can break this data down in an analogy of baseball. So this particular reporter understands baseball, and he's got a sports background, and so we were talking about, if you're looking to hire pitchers for your team, if you're going out and recruiting pitchers, and you're just looking at their ERA, and you're not thinking about, hey, am I getting this pitcher to be a starting pitcher? Am I getting him to be an interim reliever? Am I getting him as a closer? And if I am getting him as a closer, it's not just what is ERA, it's what is ERA with men on base, how's he against lefties, how's he against righties, et cetera, et cetera. So, and I see the question from Lisa there. I'll get to you just in a second. So when they present the data, it's presented in one big bucket. It's the state of Ohio. What you have begun to see a little bit more of in the last couple of weeks has been a little more conversation around what's going on in the prisons, what's going on in our nursing homes and long-term care facilities, a little bit more granularity around even like veterans long-term care facilities.
Right.
But they still, on data at the highest level, when you go into the site, they haven't broken it up. Even in their presentation and discussion, and some of this isn't unique to Ohio, by the way. This is almost like it's been a problem ever since the Imperial College came out with their model in England back at the beginning of March, which freaked the whole world out. Those are the numbers that you heard at the federal level. Fauci and Brex and Trump and others were talking about millions of people dying. So that kind of got everyone going in the wrong direction at the first place, because they assumed this peanut butter spread approach from an epidemiologist's perspective that everyone is equally has an equal predisposition to receiving the virus, and they're going to react the same way. They're going to be just as contagious and just as likely to transmit it to others. And what we saw coming out of China, we had, I saw this data myself, and I'm like, 7 steps removed. I'm looking at public source, and you could see that the average age was 80 years old coming out of China, and everyone's questioning data. It's like, well, what were they? Well, you go to northern Italy, and you saw this is the last week of February, first week of March, average age of death, 80. And you say, well, okay, well, what's unique about northern Italy? What's unique about the demographic? What's unique about the population? How they interact, et cetera, et cetera. Right. So you start to look at that, and you say, as it comes into the United States, then how should we look at this? Well, the first outbreak's in Washington. Where? In a nursing home. So you get the very first indication of the very first case that we had documented. Now we know now that there are other cases in California, even now in Ohio. We're starting to count cases that were, earlier, as early as January, maybe even before that. But at that point, what we knew was it came in, and the first outbreak was in a nursing home. When it came into Ohio, the first place that we had an outbreak in was in a nursing home. So we kind of saw the pattern coming out of China. It comes to Italy, and you start asking yourself the question, especially now, looking back 2.5 months. And I can tell you that my grandmother's nursing home, literally today, I just finally got the word that they finally have enough PPE today. And that's because I've been on the phone talking to anybody and everybody I possibly can to try to get attention drawn to it, and others as well. And they're taking donation for cleaning supplies and for gowns. And we've been listening for weeks now as our government's telling us that they're going to surge the test. The workers weren't being tested regularly. And we kind of know that all over the place right now. And that's how it's gotten in the back. We'll call it the back door, but so people are calling it the back door, but it was the front door, and we kind of knew it all along. It's not an easy answer. It's a very difficult question. How do you deal with this problem? Not just of helping those folks that are the most vulnerable to live, but trying to figure out how to, I'm trying to keep them not from dying from this, but actually helping to figure out that they were able to live. And Carrie, you're right. I see your comment here. The 44% of cases in Ohio are in nursing homes. If I could tweak that number, it's actually not 44% of cases. It's 44% of all deaths are in nursing homes. So the numbers are staggering. And I may correct myself on my data here more than once. I get a little excited when I start talking about it, but
I only know one other guy that gets excited about data. He's a friend of mine in Nebraska.
Yeah, and as a matter of fact, I'm listening to myself backward, and it's like 44% is actually accurate, and it's 60% of deaths. So I'm already correcting myself here, but that's okay.
I was going to say I read 60% just today. So
yeah, well, that's our friend at the Dispatch that has dove into data. Really appreciate that. So yeah, over half of the deaths have been from folks that are 80 plus. I think the number is 52% right now. Approximately 75% of folks that have died from COVID are over 70 years old. It's not to discount. My grandmother is one of them. My parents are 70. It's not like it's a cold-hearted statement to just call out what the facts are.
Right.
But the idea that just because we don't know how much children are transmitting things doesn't mean we don't have the capability to protect vulnerable population from anybody who's going to transmit COVID. So,
Well, and and I'm just going to say this, and I'm not saying this to be controversial in any way. You and I already talked about the video that YouTube keeps deleting of the two ER doctors out in California, and I've had other doctors, medical doctors, say COVID-19 is no more contagious or deadly than regular strands of flu, than some of the strands of flu. Every single year in the United States, we lose between 40 and 60,000 people to the flu.
yeah.
And I heard that the CDC just backed their numbers way down from what they were reporting at 60 some thousand deaths in the United States, and they dropped them down to 30 some thousand. Like,
Yeah. So
is that true?
we could spend 30 minutes just talking about this particular topic. I'll just say it this way. What I learned, and I didn't know this myself until a couple of weeks ago, as I was digging into it myself. The majority of the flu cases, deaths, hospitalizations that are tracked on the CDC website, as well as Ohio has their own tracking mechanisms, they're all estimated. They're all estimated, all of them. They don't test for the flu. They don't test. So 36 million cases of the flu, I think something like that last year. They don't test 36 million. To get 36 million, let's just look at this. And this actually is part of the COVID data discussion as well. To get 36 million positive tests for the flu, you also have to consider how many negative tests there would be for the flu. And so then you have to go and ask, well, how many tests did they actually run for the flu? 50 million, 100 million? And you'll find that it's actually in the thousands. It's not millions. So it's all estimated. And they're not hiding that. If you go to the CDC site, it's right there in plain lingo that these are estimates based upon when folks come in, doctors can even do it without seeing a patient. They can, diagnose flu. So what they're doing right now is, because COVID has the very, very similar upfront type of symptoms, this is how they kind of blended the data together. And so when you look at this data come fall, come next spring, what you're going to see on the CDC site, and they're already starting to do it, is this blending together of upper respiratory illnesses. And if I'm the CDC, or I'm sitting in one of those chairs trying to figure out how do we parse this data out, because none of this is tested,
Right.
Well, I say none of it, but a very low level is tested. The kind of testing we're doing for COVID right now is unprecedented. And it's, there's all kinds of problems with it. We won't get into it, but they're fleshing through all that right now. I'm listening to our own state I'll listen. So 2 days ago, the prison director was on, and they were talking about the testing policies. For those of you who don't know, here's another little fact about our data. So I believe it was the second week of April, approximately, when they decided to go into two of the, it's called data sampling for a reason. Thanks, Maurice. Exactly right. And there's nothing wrong with sampling. It's a great statistical model. It's a great way of going about estimating. It's just COVID and flu are so similar. It's going to be very difficult to parse this out and say which was which when you're just estimating.
But I have a question for you about that. And I'm not calling anybody out. This is me thinking logically, and maybe it's not logically. I don't know. But when you say there's nothing wrong with data sampling, I don't disagree with you when you're talking about, well, how many touchdowns did the Steelers score compared to the Browns? I mean, that's pretty easy. Well, let's go with a more difficult. But when you're talking about data like that, but we're talking about data that they have literally panicked the entire world with, and businesses have been shut down and gone out of business and personal bankruptcy, and a lot. I'm not talking a couple of cases. Thousands upon thousands upon thousands of businesses are gone forever now as a result of this data sampling.
Yeah, well, data sampling is part of it, or data modeling is another question. So data sampling is actually what we're going in, and we're actually doing a scientific sample of a population. The problem with general population sampling is if you've got a situation like we've got right now with COVID, where it does not impact people equally, and then you're just making a massive assumption that,
Right.
which is what they did in the with empirical data modeling, that the disease is going to spread equally over the population. Some folks, I was telling you this earlier, have seen the commercial on TV or YouTube web, whatever it is, of this ping pong ball illustration where you have a whole bunch of ping pong balls sitting on top of these mouse traps. So when this ping pong ball is dropped, and it's to illustrate one infected person on a population, you see the ping pong balls just were spread like rapid fire, but they're all equally distributed. To make that data model work, you'd really have to constrict your, I don't want to call them samples, but your population centers, your density is another way of looking at it, and do it around these congregated settings, which are prisons. And you'd have another little one over here with a nursing home and a nursing home and a nursing home. And you'd see a much different dispersion than this kind of equal dispersion that they've laid out. So they've panicked everybody that we're all equally susceptible. And that's why I do have a problem with the message that's being communicated at the press conferences by Dr. Acton regularly, as she talks about young people being infected, and folks, young people can have strokes. And, so I'm going out and fact checking immediately. The day she said young people can have strokes, I look it up, COVID and strokes. I find the article. It's in New York, and there's 5 cases of young people, quote unquote, that have had strokes. Those young people are between 35 and 55. One of them has a previous stroke. All of them, except for one, have a prior condition. One of the 5 passes away, the rest recover. None of them, and I believe 2 of the 5 had been tested positive for COVID, and the other ones were assumed. So then, and that's fine. I mean, that's the start of a study, right? That's how these things start. You find out some information. It's a new disease. But what the problem is that Dr. Acton has gotten up at the press conference, and as immediately as she has a potential bad news to give us about COVID, especially as it relates to age and the demographic affected by COVID, she goes right to that particular message. And that's what we hear at the press conference, is that, young people can have strokes. And now there's this conversation about children in New York that are seeing this inflammatory disease. And Dr. Fauci himself has been on both sides of this particular conversation, which, by the way, when you're this early in your hypothetical journey around a science question, you can be on both sides of it, and there's nothing wrong with that. But the problem is when you only present one one set of data and one story that aligns with the message that you're trying to send, which is everybody can be equally affected, everybody can die, stay home, hold on, clutch your kids, and so the story I was mentioning a little bit earlier is about the second, third week of March. I started making inquiries. Why are we only on the data set sharing with people what the average age is of someone who tests positive? Why is that a significant data point? I want to know what the age is of someone who's hospitalized, and what's the ages of folks that are dying from it. So these are the data points, right, that were shared. Every single day you would hear Dr. Acton say, well, people from 1 to 101 are contracting this. And she would say it in a way that made you think that everybody was equally susceptible to dying. What she wasn't sharing, and is yet to be on the top line trend dashboard, okay, so your average age of getting this is 50. By the way, we should be using, looking at means versus averages. What's the mean age? So that's a whole nother conversation. But you look at hospitalization, the average age of hospitalization, 67. The average, not the top age of death, the average age of death is 80. To get an average age of death, we'll just go with the pure averages here. That means if you have 100 people, 50 have got to be under 80, and 50. So you kind of get the feel here. All right, maybe this isn't quite so 60 to 100. If you have 100 people, that's how you're going to get an average age of 50. So I'm trying to make some simple numbers here, but it's just, it's a story that's being told. I was told, and I'll just say what I was told. So I was told, quote unquote, that they are very well aware of why they're not sharing this with people. They don't want people to know. This was back in March. We don't want people to know that the average age of hospitalization is the mid 60s or late 60s, and that the average age of death is at that time was 78. It's now 80. And that's because they were, quote unquote, afraid that people wouldn't follow their orders, end quote. And I started having a problem with it at that point.
So, okay. So
this is in March. This is late March. They already had the data in front of them from China, from Italy. You started to see what was going on in New York. And then we had our own data in Ohio, which had already started to show us what the problems were and where we should focus our attention. Instead, we spent all of our time figuring out how to shut businesses down, how to shut the schools down. And we'd shut the nursing homes down, but we had no plan on how to supply them with PPE, testing on a regular basis. And literally to this day, we still haven't tested all of the workers at our nursing homes. There are no answers to that. Finally, the press is starting to give some good questions in the last week or so, and I appreciate that. I'm glad that there's that kind of attention.
I have something I'd like to put up on screen. I don't know the accuracy of this. You may, but it's something I saw. Excuse me, I saw on a post or something, and I'm like, I'm going to save that image. Look. This is what's your risk of dying from COVID-19 in Ohio? This was as of 5/17, so a few days ago. 0.01% of Ohioans have died from COVID-19. 92% equal age of 60 plus. 78% equals 70 plus. 52% 80 plus. 5% 50 to 59. 2% 30 to 49. 73% are in prisons or nursing homes.
Yeah, that's
zero children between the ages of 1 and 19 years old. Zero.
So
they shut down the schools.
Correct. And the statement that's being made is that we're shutting down the schools because two reasons. One, the children can infect older teachers. Okay, so I get that. And then secondly, that they're going to be transmitters when they go home to their elderly grandparents or whoever. And I'm just like, okay, so we're not capable of protecting. It falls apart so quickly, that particular line of thinking. Now, the discussion about protecting teachers is a legitimate one. I mean, so if you got teachers and you're afraid that kids are going to pass it on to the teachers, you got to have a discussion about how do we. But that discussion was never had. We didn't have a discussion. What's that?
The teachers should stay home.
Have the teachers stay home and figure out different ways of doing it. You could have teachers standing up there in full-blown PPE. We're doing it. So the idea that we have to shut everything down in order to protect everyone is I said it right at the beginning. I was telling friends, this is completely unsustainable. There is no end game to this. This is the kind of thing you get in without having any idea how you're going to get out of it. And we're still, as we come out of it, we have no idea what we're doing right now. It's all guesswork. And by the way, back to how we started this conversation, that's exactly what the judge in Lucas County has decided, is that there's a complete, arbitrary. I'm sorry, I said Lucas County, but it's Lake County. Lake County, and Judge Lucci there said exactly that there's basically no standing for what's going on. I mean, you saw the headline that you put up there before. And to speak, to that whole, I think even the judge in this ruling, the way she wrote this particular injunction, and everybody who is on both sides of this issue. So folks that are advocating for, Free Ohio, the folks that are advocating for opening up businesses, letting kids go back to school, no matter who's on that particular side of it, almost everyone will give grace for that first 2 weeks of shutdown and lockdown. It's sort of like, hey, you've determined that the incubation period is 14 days. You're the doctor, you're the health director, you've consulted, you've decided that's what the incubation period is. Therefore, let's go quarantine and let's get over this as quickly as we can.
For a couple weeks. That's right. Honestly, that's what I originally thought was. I think everybody did, right? Like, hey, this could be a couple of weeks. It makes sense. Let's just shut down for a couple of weeks and enjoy our families for a couple of weeks. But let's face it, even the greatest family in the world gets old after being locked in with them for 10 weeks. I'm just kidding.
So
I'm totally kidding.
I'll read to you a little bit from the ruling today. So they actually speak to the Ohio code here. If anybody's on their computer, and you can actually type this code right into your website browser, and it'll bring the Ohio code up. You can read it for yourself. But this is the code that's quoted in the injunction. Ohio revised code is called R.C.3701.352. Prohibits the violation of any rule or order issued by the director of the Department of Health that is issued pursuant to Chapter 3701 to prevent a threat to the public caused by a pandemic, epidemic, or by a terrorism event. So that's the part of the code that we're all living under right now, and it's legit. It's there. It's given that kind of a broad authority to the health director. The very next part of this injunction, Section 20, if you actually have it pulled up and you're reading it home.
Oh, I don't. I don't.
It's all right. It gives, so it's in the injunction. So pandemic then is defined by the Ohio Administrative Code, means an epidemic disease that is occurring throughout a very wide area, usually several countries or continents, and usually affecting a large proportion of the population. So that's in Ohio Administrative Code 3701-3-01 parenthetical S. I don't know what that particular means, but what I missed and what many people missed, and the lawyers who put this together did a fantastic job, is if you just look at the revised code and you read what I did before, it gives that great latitude by the governor and his health director. But what no one has done up until this point is pull the administrative code in, which gives definition to the terms that are in the revised code and starts to draw it in. So then the criminal penalties, it says, I'll just read again, attended on a violation of the director's orders is whoever violates Section 3701, the one I read before, is guilty of a misdemeanor of the second degree. So that's what you heard the governor talking about on Monday in the crackdowns of people that are violating, they're standing and drinking at the bar instead of sitting because the guidelines say you should stand instead of sit. And we could talk about that for a half an hour. My favorite that just came out was with the low contact, no contact sports with baseball. And here are the guidelines for baseball. You can't spit.
Listen, I'm just going to be honest, man. It's pissing me off. But go ahead. I mean, it's pissing me off. You said it earlier, and I'm like, oh my God, I think my head's going to pop.
Yeah, you can't, I got to get it out there. I got to tell those folks. So you can't spit. You can't chew gum, you can't chew seeds, and you can't chew any other materials. So you're a third grader, which, by the way, this was me. I'm a third grader out in right field because I stink at baseball, right? And I'm a third grader out in right field. I'm picking dandelions. About the only thing I've got going for me at that particular moment is the bubble-licious that I'm chawing on the side of me because I'm going to be just like I'm dandelions. I'm chewing my gum. And the health department can come and pull me off this field, So and the coaches have got to work.
Charge your parents or the coach criminally.
I don't know. It's crazy. So that was my favorite. I had a friend send me one yesterday about and this is not just Ohio, right? It's all over the place. They're talking about handling tennis balls, and you can go where you want to about handling balls. I won't repeat the whole thing, but Nassau, North Carolina, it's a great one. It's out there. So shout out to who you are that sent that to me. So let me keep going here. So the criminal penalties are in this law, and they're legit. So if someone's asking, hey, how does she have the authority to do that? Well, this is the authority that she's been given to do it. So the Department of Health then, and this is kind of states out.
Acton.
Yeah, this is Dr. Acton. Come on now. I'm being kind. We're just sticking to the facts, sticking to the legal story here.
It's your job to be kind. I can play the devil's advocate over here.
Yeah, you do it.
All right, I'll shut up.
It's your show. It's your show, right? Let me see here. Where was I? I'm losing my mind now. That happened a long time ago. All right, you still there?
Yep, I'm here.
Oh, all right, I lost one of my ears here. Hold on a second. You talk to me again?
Yep, I'm here. Can you hear me now?
I hear you now. Yeah, that's good. All right.
Good.
Okay, so it's important for folks to know this, though, because if they're questioning what authority and what are the rights, the good thing about this injunction, if you go out and find it on the web, you'll be able to kind of read through what are all the different pieces of the law that does give her this authority. But here's where these lawyers did a great job of starting to break it down. They tell the story of what Dr. Acton and the health department actually did. The Department of Health informed the public and stated on its official website that the incubation period for the virus was 14 days, and they give the URL to the website on the COVID-19 community spreads. It's all on the state website. So the director was granted ultimate authority in matters of quarantine and isolation by the law. I'm reading here. The Department of Health defines those terms. Isolation is the separation of an infected individual from others during the period of disease communicability in such a way that prevents, as far as possible, the direct or indirect conveyance of an infectious agent to those who are susceptible to infection or may spread the agent to others. I know I may be boring you with a little bit of legalese here, but it's good to have the facts out here. So a quarantine, then it says quarantine, quote unquote, they're defining terms, right? This is important for us to define what the terms mean. Quarantine is the restriction of the movements or activities of a well individual who has been exposed to a communicable disease during the period of communicability of the disease in such a manner that transmission of the disease may have occurred. So they're defining who a sick person is and what you can do with them, who a well person is and who you can do with what you can do with them.
But what you just said was to a well person who has been exposed. And so what they've said then is, and this is where I have the problem, I'm sure everybody does, is how you don't know if I've been exposed to it. How can you quarantine me?
Right. And so the idea that she came out with at the very beginning of March into February was that, up to 100,000 folks may already have this. And interestingly, flash forward to mid-April, she said up to 15% of the population might already have been exposed by mid-April. Well, that's over 600,000 Ohioans. Interestingly, the exact same day that she said that, Fauci on the federal stage said that up to 50 million Americans may have already been exposed to it. Well, 50 million just happens to be 15% of 320 million or whatever it is. So they're both saying consistent numbers, which tells me there's a dialogue going on in the epidemiology community that's about the number that they're thinking has already been exposed to the virus, somewhere between 5 and 15%. And then we get these numbers coming out of New York, Santa Clara County, California, University, which is Stanford University. Then we have University of Southern California. So we're talking about big, authoritative, I'll use the word, educational institutions with epidemiologists with lots of letters behind their name. They're coming out with these studies. So LA County does this study with USC. Both of those studies confirm 4 to 5%. University of Miami does a study in Miami-Dade County, the most populous in the state of Florida. They come out with the same kind of number. Then you got Governor Cuomo, almost called him General Cuomo. Let's not go there. Governor Cuomo, who his staff actually, to give him credit, to give him credit, I watched a lot of his press conferences too. His staff did a great job of laying the data out, and they did it very honestly and very transparently. And he came out and said, we're going to be the #1 most aggressive state in antibody testing. And they jumped on it. And so just about the same time that these other ones came out, we found the numbers that up to 21% of New York City had been exposed to it. And in the other parts of upstate New York, which was where my sister-in-law is from, and that around 5% again. So you got this real consistent number. And it was all over the news for about 4 or 5 days. Then all of a sudden, it goes quiet. And suddenly, then the next story you hear is, well, we're not sure about the accuracy of the antibody tests, blah, 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 because what this whole part of the conversation does is it changes everything. Yeah. If you have 600,000 Ohioans who have already been exposed to COVID, that's an impossible math model to be able to do sustained contact tracing, okay? And there's no way you can possibly protect everyone. And it's got us on our way to the famous term of what's called herd immunity. You got to get to 65 to 70% of your population that has been exposed to the virus to get to herd immunity, which is the model and folks have talked about that Sweden's pursuing, which, by the way, if you weren't familiar with it, Sweden never shut down their schools.
Right.
Folks will have conversation about, well, their death rates and this and that and the other. Our job in the United States and around the world was to flatten the curve. It wasn't to eliminate any of the deaths. The only deaths that we said that we were going to save lives were the deaths that were going to be caused by our hospitals being overrun and not being able to treat patients effectively. So if 100 people were going to die from the disease and your capacity at the hospital to treat people, was 50 or 70, something like that. I'm throwing out some numbers here. What they're saying is that if 150 people came and needed to be treated, you're overwhelming your hospital system. Therefore, you're going to see more people actually die than would have naturally, quote unquote, from the disease. So if you flatten the curve, that same 100 people is going to die. They're just going to die over a longer period of time. Somehow we lost sight of that particular discussion. And when we look at Sweden, we say, oh, their death rates are higher. Their death rates are higher, but it's not because their medical systems are overrun. They've got plenty of medical capacity in Sweden right now. So the people are just dying because they're getting exposed to the virus and they're dying. And there's no vaccine. There's no cure. A vaccine's not a cure.
And I forget where I read it just here a little bit ago. I read somebody said, let's not forget, maybe it was my buddy Brian had a post. Let's not forget that there's no vaccine for the common cold, and the common cold is from the same COVID family of viruses.
Yeah, I posted that as well. I got kind of roasted on that. Folks didn't want to hear that particular conversation because what they'll do is they'll break down coronaviruses and they'll say, well, certain of the coronaviruses are only in animals and certain ones are only in humans. I don't care. They've never come up with a vaccine for any of the coronaviruses.
None of them.
Right.
None.
So if they do, great. Yay for us.
They're
If we
not
find a
going
vaccine.
to.
But it's going to be time. It's, at a minimum, we got another 6 months. And so how many people, you've already said this, how many are going to die from all different things? So the judge, back to our topic here of Ohio and what's going down. So for the first time, we have a breakdown now. Okay, who are the people that are sick? Who are the people that are well? What's the Ohio law actually say about those folks and what we can and can't do to them? So the next section after we deal with sick and well people, it says in the administrative, and this is the really key part, Administrative Code 3701-3-01, the duration of the quarantine ordered shall be equivalent to the usual incubation period. So
which
those
is,
of you, go ahead. It's
14 days.
14 days, exactly.
14 days.
And so the incubation period, the next sentence, can be up to 14 days, according to the Department of Health.
Right.
And then so the next section says, the director has quarantined the entire population of the state of Ohio for much more than 14 days. That's kind. The director has no statutory authority to close all businesses, including the plaintiff's gyms, which, if you're not familiar with this particular case, 35 gyms and fitness centers came together to file this suit. By the way, another important point, they filed the suit before the announcement last week was made that gyms could be open. And when all the extra administrative rules came out about gyms and fitness centers, which, by the way, I have a friend that's actually on that team. They didn't even start meeting until about 2 weeks ago. So I have a problem with that. We had the entire month of April. I remember Dr. Acton mid-April saying, oh, well, we have plenty of time to get this right, in terms of, she was referring to when we actually go back to ramping things up. Plenty of time to get these things right. So these business groups that were put together to write the rules were not formed until about the first week of May. And then they were scrambling and they only had a couple of sessions to throw stuff together. So my friend who serves on the one committee for gyms and fitness centers, I was tracking with that whole thing and providing information and helping them out. And they were scheduled to get together last, I think it was Monday. All of a sudden, this lawsuit gets filed, I believe, on Monday, and they were, I think, scheduled to get together on Tuesday, and they were told, you need to wrap your work up. Well, they weren't scheduled to wrap their work up until Wednesday or Thursday of that week, and as soon as this lawsuit was filed, they were told to hurry up and get their work done. And so that rushed to completion of that particular set of gyms and fitness centers, and I think aquatic centers were included in that, and dance and some other things were all included in that. And the same day that the lawsuit came out, they got on the press conference and announced the date of the 26th to open up gyms and fitness centers. So you know that they knew they had a problem on their hands, and they were trying to kind of cut it off at the knees. And I actually thought they might drop the suit, but they didn't. They went ahead with it, and
which sets a precedent, though.
It
I mean,
does.
that judge, not just because you and I talked about this earlier, it sets a precedent with the Supreme Court in Wisconsin.
So we've got the state of Oregon, and we had a lawsuit filed there, successful, has overturned the governor's health orders. We had a lawsuit in Wisconsin. That was just 2 days ago. Lawsuit in Wisconsin last week overturned the governor's orders. And interestingly, there, the same night that it went to the Supreme Court, they challenged it. The Supreme Court ruled in favor of, I'm gonna say it this way, ruled in favor of the people and business and people's health. It's not just about the economy versus health. It is health. I mean, when you're talking about gyms and fitness centers, the idea here is to keep people healthy, right?
Yep.
That's the whole idea of a gym and fitness center.
Yep.
So anyways, Wisconsin, the same night that the Supreme Court overturns the health director's orders, which it's just a free-for-all, it's the Wild West. That same night, health departments in Milwaukee, and I have friends that actually we're talking to, and I'm providing consultation to an organization that's I would just say fitness centers all over the country, and one of the guys on the team is based in Wisconsin, in Milwaukee County. He's like, well, hey, the health department decided just to go ahead and slap their rules down. Okay, well, that's legit. They're allowed to do that. But now it's up to each individual health department across the state of Wisconsin. So 2 days ago, they came back to the governor and said, are you going to try to reissue your orders? And he said no. So that he's going to leave it up to the health departments. And today, those health departments have started to roll back. So instead of more health departments layering on restrictions, it's gone the opposite way, which encourages me, as other states are looking at that situation, to potentially see that as a precedent setting as well, like you said. So now you've got the state of Wisconsin with its population. I'm not actually familiar. I can't remember if it's 12 million or what the population in Wisconsin is, but it's large urban centers, and they not only are they open now, 100% open, they also have no restrictions. So there's some interesting stats now from Ohio perspective. We've got the governor and lieutenant governor telling us that 90 to 95% of our businesses will be open as of this coming Tuesday. In my perspective, I should say, is, well, you might have 95% of the businesses that are able to open,
right?
But you're not going to be at 95% business capacity on next Tuesday. We've got so many regulations layered in these guidelines. Restaurants can't open at some 25, some maybe, if they're lucky, 50% of capacity. I just read about another really great restaurant that's been around for a while over in New Albany that's closing because they don't have a viable business model at 50% or less capacity. So while the governor and lieutenant governor and Acton are saying that they have to put all these rules in place to give people confidence that they're going to come back out and actually go to businesses, that the only way we can save business is to put all these rules and restrictions on them to make people feel safe. Well, the businesses are saying we can't survive underneath of these rules, so it doesn't even matter if we could have 50 people in our restaurant and you're going to tell me that only 25 are going to feel safe, then I can't operate and I'm closing. And that's what's going on right now. We got businesses permanently closing as a result.
A lot of them. There's what's the Italian joint over there that was over off of Sawmill and Bethel Road forever. I forget there's an Italian restaurant down there. They had a couple locations in Columbus.
Clearly it's one of your favorites.
Yeah. Well, I haven't been there in a long time, but yeah, I mean, they're gone. I live in Marion, dude, so we don't get to Columbus very often.
Oh, you're in Marion. So Marion's a great illustration. I was just telling one of the reporters this yesterday. You go into you look at Marion is one of the top 5 spots in the entire country right now.
The worst. We were number 1.
Right, for yeah. Well, I think one of the hottest. ever. Well, it's because you went into a congregate setting and you test everybody, and all of them. It's, oh my goodness, everyone's got COVID. But what's the hospitalization? What's the death rate coming out of it? And that's
Zero.
where
Well, not zero, but it's
zero.
low.
And it's tragic, the folks that are getting sick, and the tragic.
Yes, it is.
There's some workers and so forth. But that's a great example of what's gone on with the data. They take that data set and they go and they dump it into the statewide data. And suddenly these trend lines at that time was 5-day trend lines. It was right before they were announcing the opening. And it shows this giant spike in cases, and people who had no idea that it was being caused by the Marion Correctional Facility being fully tested had no idea. I got bombarded with texts from people. How can we be opening when we're having this huge spike in cases? So people have this perspective that it's just spreading. You hear "stop the spread."
Not Buca de Beppo. That's not what it's. Bravo. Thank you, Laura. Bravo.
Thank you, Laura. Thank you.
Yeah. Bravo. They're done.
Yeah, I did hear that. So you've got this peanut butter spread view of the data that any case that pops up in Franklin County Correctional Facilities, Marion Correctional Facilities, I'm not naming them all by name right now, but they have these spikes going on. You're not telling people that, and then you're seeing these zigzags across the screen. And then you get the governor and the health director coming up with explanations and saying different things. And quite frankly, it's making them look bad. Sometimes they're actually telling the right story that we're flat or declining, but they need to put the data up in a way that makes sense to people and that you can actually understand it. So you've got, your starting pitch I mentioned before, that's your inner relievers, and then you got your closers. And right now we just have this blend of everything together. And what we're seeing, instead of a clear picture that of this curve and all this flattening that they talked about, you see this weird zigzag in the data. And it's because they don't enter the data into the database the day that the event actually occurred. And when they do, they're giving no context to the congregate settings. So we have two problems going on. When Marion Correction Facility has 800 cases that get dumped in one day, that's accurate. It did actually happen in that time, but it's not a trend across the entire state affecting, there's 22 counties in Ohio right now who don't have a single death.
Right.
Zero. But yet they have all of the same restrictions put in place, which, by the way, again, back to our case, that's the point that's being made by our judge here. And so I'll kind of wrap it up with this. So the director quarantines the whole state of Ohio, and the judge is kind of like laying out the story.
Yep.
For much more than 14 days. The director's done this with no statutory authority to close all businesses, including the Playdum's gyms, which she deems non-essential for a period of 2 months. And if you read the full case, they talk about how they've left car washes, and they've left lotteries, and they've left weed stores and marijuana stores. They've left these stores open, but they've closed gyms, and they've closed this, and they've closed. So this kind of summarizes it up here, and it says she's acted in an impermissibly arbitrary, unreasonable, and oppressive manner, and without any procedural safeguards.
Yep.
That's really strong language. That's way beyond what was necessary in this to be able to state this. And I think they actually summarized that in the article you're looking at.
Yeah. Well, down at the bottom, they talk about violate separation of powers on its separation of powers on its face.
Yeah, so that's the actual attorney you're reading there, a quote from the attorney. So I will comment on that. So the attorney believes, and his legal team believes, that this ruling is going to become a standard for other businesses to file suit and to get this entire process. Paul Margraf, hey Paul, that's one of my friends. I got 2 friends out there. Paul's one of them. So. Larry pointed out that the only curve we flattened was Ohio's record economy. And there's actually data to support that as well. So while we were talking a little bit ago about 600,000 people that Acton at one point said, and she had to say 100,000. Well, we've actually started doing these estimates and testing on people back in January and February. So I was starting to talk about the 2 problems with the data. Thank you. Laura's my other friend.
Is she related to Monty by chance?
Could be. Yeah, I think so.
I know Monty.
Yeah. So we've got data that's from congregate settings that's completely disrupting the curve, quote unquote, or disrupting, let's just say, the trend lines that are communicating a message to people. So you dump all this data in, it causes a spike, causes people to freak out. The second thing that you've got going on is data dumps. And what a data dump is you go back and you're continually receiving data or updating data from January. You got 200 cases. From February, you got 300 cases. And those are actual real numbers I just gave you. So 500 cases from January and February over the last couple of weeks have been dumped. And when they get dumped, if it was on May 12th, that 200 more cases are dumped, that goes and gets recorded by the state and then communicated out from the dispatch and other media outlets that Ohio had 200 more cases yesterday in the last 24 hours. So the average Joe is seeing this and they're saying, look, it's still going up. It's still growing exponentially. And if they saw the actual numbers, the deaths and hospitalizations are the same way. They're reporting it all the same. As a matter of fact, if you look at the trends for deaths, over the last couple of weeks, the average number of deaths per day has exceeded the total number of deaths that have actually occurred in any given day. So and the reason that's happening is because in a trend line view of an average, if you dump 50 deaths on top of 20 that you actually did incur 2 days ago, now you're looking at 70 deaths that happen on a day instead of 20.
Because that's the day they were reported.
That's the date they were recorded in the database. So it's not dishonest, but it's misleading. And so if you go back then and you look at the data, you'll find there's not a single day with more than 50 deaths that has ever happened since the beginning of this entire scenario. And as a matter of fact, the average number of deaths on any given day is actually between 20 and 30. Somebody right now on the website, you could go out there now and it says like the average number of deaths in the last 21 days is about, I think it's like 63 or something like that.
Somebody said, I'm looking for the comment. I think it was my buddy Ernest said that, this governor up in Michigan, have you done?
Oh yeah, you couldn't plant gardens for a while. You couldn't go to Home Depot and buy seeds to plant in your garden. I mean,
I know you couldn't buy paint or stain for your deck. You couldn't do anything.
Yeah, you could fish from a metal boat. Or let's see if I get this right. You could fish from a metal boat, but you couldn't fish from a wooden boat. And I think that was based on the fact that the virus supposedly lived longer on wooden surfaces than metal. I might be getting it backwards, but they shut down fishing from certain types of material boats versus other types of material boats. It's insane. This is what you get when you get bureaucrats micromanaging every element of life and the economy and everything else. But to kind of wrap up on the gym situation, so she's acted in this arbitrary, unreasonable, oppressive manner without any procedural safeguards. And so the judge then agrees that the movements have shown a strong or substantial likelihood or probability of success on the merits. Now, that's a very significant statement because what the judge is saying is that based on the merits of this case, she expects that when it gets appealed, and it will get appealed, that it goes to the appellate court, and then it'll go directly to the Supreme Court most likely, is that she expects this case to succeed on its merits. That bodes well for anybody else who wants to use this case then as a basis for their lawsuit. And I think right now of a child care center who's not allowed yet to open until May 30th. I'd put them in a group and go file suit tomorrow. The other groups that have not had any date yet, which we might get tomorrow.
Restaurants.
Well, restaurants are already open, but tomorrow at the press conference at 2:00, we're supposed to get announcements on some of the other areas who, like contact sports. For instance, my daughter plays volleyball, and volleyball evidently is a contact sport. I didn't know that. Baseball is low contact. Volleyball is high contact. I didn't know that, but that's how so we're supposed to get some additional rulings tomorrow. I don't know if we're going to get fairs, theaters, all this type of entertainment with large groups, but all those businesses are, completely shut down right now. This particular ruling gives all of them standing in a position from what I'm reading, and this is what the article you showed earlier, and what a lot of folks right now, at least that attorney believes, and others do as well. So our Attorney General Yost is looking at all this tonight. We'll see if there's an appeal tomorrow. The close of this whole thing with, it's a 9-page. It's not extremely long. It's about 9 pages, but I'll read here the kind of the conclusion of it.
Well, you looked at, I want to share real quick. You mentioned that video of the ping pong balls. I want to show that. Can I?
It's a good laugh. Oh no, this one. Okay, the ping pong balls. Yeah, I thought you were talking about the tennis ball video.
No. I think everybody's seen that.
Go look it up. Nassau County. We're not going to show that one. Yeah, but here's the ping. I love this because we're talking about science.
Yeah,
we're talking about wanting to use good science. And by the way, our tax dollars have gone to pay for this particular video to be put together, and so we can talk about the science and the problems with this. Okay, go ahead and play it.
Let's watch. Let's let everybody. It's 31 seconds. Let's watch this real quick.
Yeah, it's fear mongering at its best. It's music like it's like from Braveheart or something.
Jeez.
And so now we're going to spread everybody out equally.
Oh my God.
And we're going to somehow prove to everybody that social distancing works, and a little space makes us all safer together. We're in this together. So this kind of propaganda is not based on actual science, and it really continues to stress an approach to data modeling that got us into this problem in the first place. We're assuming that all 300, the tennis balls was so funny. I know, Andrew. I can't get away from that. There's this consistent approach, and we're repeating the problem. By the way, you're going to hear this new statistic called R naught. And so R naught, just to summarize it, is a replication factor. And you're going to start hearing this statistic that we flatten the curve and we flatten the R naught to 1 to 1. And I'm not an epidemiologist, and I'm not claiming to be one. This is a lot of just common sense. If you are transmitting this disease inside of a prison and you go and test everybody and over 80% test positive for COVID, that is much greater than 1 to 1. Now, I don't have to be like a rocket scientist to figure out if I got 2,000, prisoners and 1,700 or 1,800, whatever it was, tested positive. You might know that better than me, Ken, since it's in your county.
Yeah, I don't watch the news. I can't
remember the exact number, but it's about.
It was 90. I think 95%. It was up there. It was like most of it.
And I believe the number somewhere around 80% were asymptomatic. And these types of stories have gone on all over the world, by the way. But it's in our backyard, literally. It's your backyard, 15 minutes, 20 minutes from me. And so, if someone tell me what the R naught factor is inside of the Marion Correctional Institute, it's got to be like 1 to 10 or 1 to 15.
What is the R naught factor? What's that mean?
Well, it's a technical term they use in their epidemiologists speak. I'll just, chalk it all up to that. It's, if you can think of R and you think of replication. So it's reproducing, or it's the contagious factor. So and she's already got graphics up there, and they're trying to educate people on this. So they want
Acton.
Oh yeah. So you're
being so respectful. You keep calling her Dr. Acton.
She is. I gotta give respect, my friend. So you got one person, and they're going to infect another person, and that's supposed to be a good number of 1 to 1, and we want to keep it at that or lower. Somehow we're at the 1 to 1, and that ping pong model is a 1 to many. And so it's interesting to me how they're going to talk about the R naught factor being 1 to 1. They're going to show that kind of an image as being the worst case scenario. Well,
it's propaganda.
What was the R naught factor in that ping pong illustration?
Right.
1 to 100. Okay, well, let's play that out. So in the prison setting, you have an R naught, a replication factor of 1 to 100. I'm just making a number up. Whatever the heck it is, it's a whole lot more than 1 to 1. And we've been told that right now, at this very moment, we're at a 1 to 1 with the data from the prison, with the data from the nursing homes packaged into that calculation. What we need to do is say, what's the R&I factor in a nursing home, the R&I factor in a prison, and the R&I factor in a dense city like Columbus or wherever, and then what's the R&I factor out in Plain City, or the rest of Marion County, or the rest of the 68, 70 counties out of 88 in Ohio that can't even see their neighbor when they walk out their front door. Okay, so the R&I factor being calculated just like the initial number when we said we were going to have 62,000 cases per day. That's what got my attention. I was like, how are you going to ever measure that? I mean, you can't even test 8,000 people in a day, let alone 62,000 tests. And then if your ratio of positive test to negative test is one out of 10, so for every 10 people you test, 1 test positive, 9 test negative. So to get 62,000 positive cases, that means you got to test 620,000 people in one day. And by the way, that's the peak of the curve. So the day before that was 615,000. The day after 1650. I'm trying to get my finger.
Oh, look at my buddy's comment.
Yeah, we are not fooled. Where is that at? Oh my word. So these numbers are ridiculous. When they were throwing them out at the beginning, everyone just saw the big spike, and they didn't even pay attention to the fact that it's a completely unprovable hypothesis. Unless you go out and you do, this massive antibody testing. And even so, then they revised the number down to 10,000 cases per day, which again, you'd still have to have 100,000 cases testing, 100,000 tests per day to get that 10%. Then the last number they put out, I think it's, without looking at it, it's like 1,600, I think was the final, or 1,400 per day. Again, you'd have to have over 10,000 cases per day tested to get that kind of ratio. So the ping pong model was ridiculous. It
is. It's propaganda.
It's true. If you're in a home, like if you're a prolific, children bearer, and you had 12 people and your grandparents and your aunts and uncles, and you have 18 people living in your home, that ping pong bottle illustration's a great one.
I was gonna like your friend Paul, but now I don't, man. He just called me Norm Macdonald.
Yeah, Paul, you're kicked out of the club. You're off the island.
Hey, that's better than Tom Hanks. Some people have said Tom Hanks. But so here's something I do want to add. Here's a factor we haven't talked about, and in my opinion, it's the elephant in the room we need to talk about. And don't hit that leave studio button when I say this.
Oh, I know what you're going to say. Go ahead.
No,
Go ahead.
I don't know if you do.
I'm good. I'll give you an answer.
There are a lot. I've seen doctors say that they've been pressured to put COVID as the cause of death. When I mean, I don't know the accuracy. I'm just throwing it out there. It could be me creating propaganda, but I saw people saying, there were people that were coming in that had just died in a car accident that they were listing as COVID-19. Yeah. And those 2 doctors in California said, why are we being pressured to list COVID-19? I saw reports saying that the federal government was paying hospitals $13,000 extra if they were treating a patient with COVID, and $39,000 if they were put on a ventilator.
Yeah,
are those true? Do you know if that's true?
It's as a matter of fact, I read the CARES Act, and it's actually I read the whole thing, believe it or not, and it's right in there. So, and it doesn't surprise me, because in my years of doing data for Cardinal
Health,
right? So my years of doing data, I had to produce help pharmacies and then pharmaceutical systems, medical systems, to come up with these reports that would help them to understand their spend on certain drugs. Their reimbursement rates for certain drugs and certain treatments were different than others. So I know that this particular practice of saying, hey, we're going to reimburse you at a set rate for a particular therapeutic or drug, or in this case, is a piece of equipment, a therapeutic approach, is something that happens. And then I read it for myself in the act and saw there that they're trying to do a good thing, right? They're trying to come up with money to support what at the time seemed like the most expensive item that they needed to be able to treat patients, and the government didn't want hospitals deciding not to treat someone with a ventilator because they couldn't afford to buy a ventilator. So there's good intention, just like there is behind most government laws. It's just when you actually get down to putting this stuff into practice, especially when you're talking about science and health like this, you're incentivizing the medical community to make decisions that they might not make otherwise. It's gonna, you hope that they're gonna do it in a way that's completely blind to that type of incentive. But I'm telling you right now, I worked with the guy who sat in the cube at the hospital system level, and he's making that decision on dollars and cents. And they would tell me how they would get into fights with their doctors because their doctors wanted to use the red pill versus the green pill. And then the guy would say, hey, I am going to tell you what pill you're going to use, and here's the therapeutic data to back it up. So we tried to make sure that there was authentic, accurate data to support those types of medical decisions. And when you're guiding a doctor to do A versus B, that there's actual science, some science to back this type of stuff up. So yeah, Angela Brooks that's a good comment. Crazy medicine is a new meaning. So this idea that everyone needs to be ventilated, now we know a month after treating people with ventilators, you've read and heard the reports, they're finding might not be the best thing to do for someone. There are other treatments available.
Killing people.
It could be killing people, right? So I don't want to get into treatment, in this conversation for 3 weeks from now. But you are exactly right. They were being financially reimbursed for anybody that is. We'll leave the ventilator part out of it and just focus on the labeling of a COVID.
Yeah,
they're highly incentivized right now to label someone with a COVID diagnosis. No matter what they're in there for, they're going to get reimbursed for it. And that's something, if that was way out there in the public right now and everyone knew that health directors at every layer in the country, I'm sorry, Devin's making a comment there. Yeah, so they made, and just to Devin, so you understand, our ventilator is bad for COVID patients, not for every COVID patient. And so I don't want to get too deep into it. But what has been found is that in some cases, they were moving too quickly to a ventilator as a solution for somebody. And I'm not a doctor, and I don't want to get into that. I can tell you right now, what you said was they're being financially reimbursed when they put a COVID patient on a ventilator. That's the part of that story that's significant. What's more relevant to us right now is this whole labeling, because it's causing our numbers to be skewed dramatically. So everyone probably is aware, New York, about 3 weeks ago, overnight doubled the number of folks that they had calculated as having COVID, because they went from people that had been tested to include everybody that they assumed, because rightly so, they didn't have enough time or testing to test everybody that was coming in the doors at the time. I don't want to get hung up in questioning that, but it is an accurate statement to say that there is a financial incentive for health systems right now to label someone with a COVID diagnosis.
Do you know that Apple's newest update, the iOS 13.5, I went in and as soon as my buddy Brian told me about this tonight, I went in and turned off auto update, and here's why. iOS 13.5 speeds up access to the passcode field on devices with Face ID when you are wearing a face mask, and they slip it in real fast, man. It's weird. And it's right here on screen. There it is. That's my iPhone right there. And introduces the exposure notification API to support COVID-19 contact tracing apps from public health authorities.
Yeah.
When did we start calling public health people authorities? Like I'm like, so Apple just like, I'm out. They're gonna do that crap, dude. I'm out. You're not gonna they want you to install software in your phone to be tracked. I don't like.
Well, let's just be clear. I don't want to freak all your viewers out. Just so you know what that's the operating system making an update so that if you decide to download a contact tracing app, that the iOS operating system will support it. Don't freak out too much yet, Ken.
What is an example of
a contact tracing app?
Yeah.
Well, they're being developed right now, so they probably already have. Well, China. Okay, so let me give you an update on this. This is gonna cook your noodle a little bit. So about 3 weeks ago, maybe a month ago now, Dr. Acton makes just kind of a quiet little announcement that we have signed a contract with Partners in Health. So those of you in front of a computer right now, if you want to look up Partners in Health, the first thing you're going to see is like children and people being treated that are really, it looks great, right? Partners in Health does a lot of really good work. I don't want to knock all their work. It's like, it's a lot of folks that are in this arena are doing a lot of great work.
Yeah.
But Partners in Health is also very tightly woven with the World Health Organization, which is fine at some level. But here's where I start to get the problem. They have been very invested in solutions inside of China around contact tracing.
Jeez.
I got a problem with us taking any cues from a communist regime when it comes to lockdowns and communist approach to contact tracing. This is not a conspiracy theory. This is just a simple statement of perspective on what our government in a republic looks like versus what their government looks like from a communist socialist regime. I'm not comfortable, loading, and by the way, I will kind of deviate from that to say there are some other countries that are not communists that have chosen to start using, apps to do contact tracing. So it's like the apps like Friend Finder, where are your friends located? I think it's really cool to when I'm at a concert and they have that app or you can go in and you can see where your friends are sitting, which is you can find each other, and it sounds really great in that context. That's right. You can find your friends at the concert and you wave at them, hey, we're here. But when it's like, hey, the health department is going to know where you're at, so they can check to see, are you quarantining or are you not quarantining? That's not necessarily a direction I want to go. So I'll personally say, I'm uncomfortable with even the idea, and this is happening all over the place, by the way. It's not unique to me. I'm just saying my own personal feeling, but I'm reading about this regularly right now. Folks are uncomfortable getting a COVID test right now because by law now, if a COVID test is found to be positive, it has to be reported to the health department.
Right.
And as of right now, under the emergency order in Ohio, if you get a COVID positive test, your name, your address, your contact information. Hey, Dan, Dan's in Minnesota. Dan State, by the way, 80% of the deaths in Minnesota, nursing homes. It's tragic. Yeah. So I digress. I don't know the stats for every state in the union, but I got a few. That was just one I happened to look at today.
I would have to say, based on the stats that we know, the data that we have, that you have, it's got to be pretty close across the board, I would imagine.
And it's no different than, again, what we knew coming out of China and Italy. When people say, well, we're just learning things. Like, no, we've known this from the very, very, very beginning. But so back to the contact tracing, Partners in Health. I watched I think it was PBS or some show on a Saturday or Sunday afternoon where Chelsea Clinton and the Clinton Foundation, not the Clinton Foundation, but the Clinton Foundation Institute. They have the institute that Chelsea runs. She was doing an interview with the leadership of Partners in Health, and they gave, it was transparent as you can get. And they were talking about what they're doing in China. They're really proud of it. And they were coming in, they want to get a deeper footprint in the United States, which they have a base here, but they don't have a lot of, we use penetration from their parts of their organization. So they're getting involved with the state of Massachusetts, which those of you know what state of Massachusetts, they're a completely social, they're one of the few states that have a completely socialized medicine. So we can understand how they'd be going into a liberal political state with a socialized medicine. But to know now that particular organization is getting a foothold inside Ohio as their second major state to get this is troubling to me. And then to know that one of their primary methods of and what they pursued in China is using apps and contact tracing in a very aggressive contact tracing model. Unfortunately, this is not something unique to Ohio, and this is a global thing. Partners Health is a global organization. This is coming from the federal level as well, Dr. Bricks. And the problem with Bricks, Acton, a lot of these epidemiologist folks, they've got a lot of background and experience in Haiti. They got experience in Africa with a variety of contagious diseases. A lot of them got a lot of experience in the early days of the AIDS epidemics and what has gone on with that, especially in Africa. And have learned a lot of their approaches from various diseases that don't have near the type of scale of replication and contagion that that COVID does. And for instance, there was a press conference about a week ago. Dr. Acton and the governor were interviewing the chief guy at the Ohio State University, who's been partnering in with our state. And he talked about how we do contact tracing, at our local schools. If there's a measles outbreak, they'll tell the parents, there's been an outbreak, your child was in this classroom, they may have been exposed, blah, blah, blah. None of us really have a problem, with that type of thing. As parents, we're kind of glad to know that. They don't give out the name of the kid. But even the head of Ohio State said, we've got experience at that level. What he said was, we have no experience doing this at scale.
Right.
And so then he makes this comment that really, I really, latched onto, because someone asked him, I'm going to paraphrase, asked him why 15 or 1,600 contact tracers? Why not 500? Why not 3,000? Why not 10,000? Where's that number coming from? And he said it's based upon the number of positive cases that we have right now. So you have to let that sink in for a moment and go back to what I was saying earlier about how we're going back and we're pulling cases up, and we're plopping them into current trend data. So that's going to skew things in one direction, or where I was really going in my mind was the opposite direction, which is to say we're way undercounting the number of cases there are. And if there's 80% or more asymptomatic people in a prison, in a congregate setting, and then you quote unquote let the virus loose in the greater population, now you're going to have 80% asymptomatic people, and you're going to do random testing, and you're going to have these 1,800 contact tracers running around, tracking down every positive test that they can get. That 1,800 is not even close to the number that they need to be able to do contact tracing if it's 400 or 500 or 600,000 active COVID cases that start to appear across the board. The whole thing breaks down. I mean, it never worked before when they were doing the models with the 62,000 a day, the new R factors, the contact tracing, all of that works on really small scale stuff. But one of the things I learned when I was at Cardinal, things that you can do on a peer-to-peer network on your computers at home when there's just two computers talking to you, you try to scale that and you break the system. And we used to joke inside of Cardinal that every IT system that we would bring in from the outside, because of the largeness of our organization, we break it because of the volumes of data and so forth. And it's natural. So anytime you have a system like this that's been proven to work on a small scale, unless you've got highly experienced people at scaling these types of efforts, it's going to fall apart.
Yeah.
So the data models have fallen apart because they've never done epidemiology modeling at a global scale and ever had it proven out to be accurate. This is the first time they've ever tried to do that type of thing, and they've fallen. And are they learning from it? Yes, but we're all guinea pigs right now in a grand, kind of scientific experiment.
I think part of the deal is we have to also trust China. And we have to trust these other countries that we're maybe not the best of friends with, that the numbers that North Korea, what are the odds that their numbers are accurate? What are the odds that China's numbers are accurate? What are the odds that Russia, and again, I don't know. I'm just saying, and here Sweden never went on lockdown, and I don't believe their numbers are any worse than ours.
No, and there's no way to through any modeling that currently exists to predict that Sweden is going to suddenly have this massive outbreak in deaths.
No.
Even if we were to sustain our current rate of death in our country or inside of our state, and somehow we are able to come up with less deaths than Sweden did. By the way, for those of you who don't understand what's going on in Sweden, two things. One, they have done some lockdown. Like for instance, they sent all the kids home from school 16 and older. Okay, so they limited large group gatherings to 50 or less. But they didn't close businesses down. They let childcare and elementary school kids, which are critical to being able to allow mom and dad to go to work every day. They let those things continue to be open. They locked down nursing homes. They'll admit right now that they made some mistakes with how they did their nursing homes. They made some of the same mistakes we have. So they're a partial lockdown, but not complete. The other significant thing about Sweden is they're the same size as the state of Ohio. It's about 10.4 million people. We have about 11 million people, so it's a similar size. They've got major urban areas. It's not identical to us, but it's really a pretty good comparison. So you go out there and you say, well, they've had more deaths than us. They've had twice as many deaths as us. Okay, it's 1,800 versus 3,200 or something like that.
Right.
Yeah, it's when you start throwing out statistics and you say things like twice as many. Well, 4 is twice as many as 2. Both of them are, small, right? In the grand scheme of things, when you were saying that hundreds of thousands of Ohioans were going to die, and now we've got 1,500, whether it's 1,500 or it's 4,000 or 5 or 6,000, every death is tragic, but it's not 100,000, not 200,000. It's none of these huge numbers.
It's not 600,000.
Right,
I mean,
600,000 cases.
Big number, man.
Yeah,
that's
and it may be possible that in our state we've got 600,000 people that have had COVID. We've just started an antibody test study. We'll see what that comes back. We'll find out what there's a word called the prevalence rate. It's an estimate on how many people prevalent throughout your community or throughout the population have it. So I know.
Here's the thing, Brian, and I again, you're a data guy and you're a common sense guy, which I like that, man. I told when we were on the phone talking with Mike, I was like, I like this dude. I think that I haven't been to Walmart, although there is a Walmart that's open here in Marion. I have been to Kroger. I've been to Meijer. My wife's been to Kroger, I don't know, every other day, I think. And you can walk like you can go shoulder to shoulder walking by people and if you think that the people working at Walmart or Kroger or wherever are constantly, I mean, they're showing people working in laboratories on this virus in a full space suit, like with oxygen and the whole, they're and you think that little tiny mask that is not effective. And I've read all kinds of statistics on that the mask is, and there's, you have to wear a mask. I saw somebody post, he was on a Delta flight and Delta was like, if you remove your mask and you're caught, you'll be arrested when we land. And it's like, I just don't, again, I go back to it absolutely is horrific that anybody has died of the flu, of COVID, of a car accident, of anything. It's terrible. I hate it. But the numbers, like the two doctors, the ER doc said, the numbers don't add up. They do not add up. Like other physicians have said, it's not any worse than other strands of flu that we've had visiting us every single year for.
Yeah, and to be specific about, people get really worked up when you start talking about the flu. Again, the estimates on flu are just that. They're estimates. The estimates now on COVID, because of the way we're coding this thing, and they're not testing everyone that they're registering as a case anymore. to some extent, those are becoming estimates as well. When you look at the whole population, you're going to come up with certain percentages, and they look really similar to the flu.
Yeah.
It has nothing to do with, Dr. Acton started to talk about morbidity, how sick it makes people, how long they're in the hospital. But again, you got to look then at the scenarios of, okay, well, how many people are hospitalized and how long are they hospital? That's the kind of data modeling we did all the time with large hospital systems. They're figuring out how many beds do they need. Forget COVID. This is what they do all the time, which is begs the question: if they do this kind of stuff all the time with data, and they figure out exactly how many beds they need, we got several months of data now. It's not like a hypothetical anymore. I mean, it's
Right.
and they got to start to figure out, all right, what's this going to look like once you open things up? Well, you got countries like Sweden out there that are going to tell you right now what it's going to look like. And you've got other countries that you got states in our own union. You got 8 states that never closed down. So Sandy's right. It's very political right now. It's a presidential election year. You've also got people that their careers are on the line now. They stuck their neck out. They made decisions early. You can't fault them for some of those decisions, but you can definitely fault them for sticking with a bet. It's just like a coach. I mean, he puts a game plan together and he goes out on the field. He executes that game plan. They always talk about the best coaches that are the ones that are able to adjust in-game decision adjustments.
Yep.
Those are the coaches that stick around. The coaches that come out with a game plan and they stick to it no matter what. It's just like whenever we get upset with, whatever coach playing for Ohio State or whoever, you pick a sport, pick a coach, it doesn't matter. When they're going to run it up the middle every time, well, it worked the first 3 times. Let's just keep doing it. And then it doesn't work the next 6 times. You think, well, we might just want to adjust our strategy. And so they talk about, halftime adjustment. So we got to about April 1st. We had enough data to start making halftime adjustments.
Are you reading that comment?
Yeah, I did. Yeah. The real data isn't scary now, though. So ping pong videos, it is. And that's exactly right. What is scary is if, like, I got my grandmother in a nursing home, that's really scary when you know that the likelihood of someone who catches COVID when they're 80 plus, it's 50-50. If they get sick, they got a 50% chance of dying. That's a really high, that's a really high death rate. Their death rate, the hospitalization rate for those over 65, if you get COVID and you get sick. Now, you got all these asymptomatic folks. So we're still learning tons about this, and we got to give a lot of grace to the medical community as they learn through all this. We got to give a lot of support to all these folks, but we also have to keep the rest of of life, not just COVID versus economy. It's like COVID versus cancer, COVID versus diabetes, COVID versus COVID versus all these other health issues as well, and trying to balance those things out is difficult. And it's not like there's an easy button to all this, but you can say this, that in this particular situation, right, as we've gotten 10 weeks into it now, we wrote certain laws to give the health director certain levels of authority to help us in a period of crisis. We got that crisis pulled out through 10 weeks now with no end in sight. The question's been asked repeatedly. How are we going to exit this emergency? When are we no longer under a health emergency? And so the judge today, and I'm reading again from the injunction, says that it's basically law enforcement officers, prosecuting attorneys, the attorney general, the health districts, all of just anybody in authority are enjoined from imposing or enforcing penalties solely for non-compliance with the director's orders against the following businesses listed in paragraph 13 of the order: gymnasiums, health clubs, fitness centers, gyms, and workout facilities. Now, here's the one catch to this as we kind of wrap up, because I know it's been a very, very long session and it's been really good. So the last thing they say is, so long as they operate in compliance with all applicable safety regulations, whether those in the state's order, the state supplemental guidelines governing businesses like those of the plaintiffs in this case. All right. So what we're what we don't know yet, and we have to wait for this to kind of play out, is those phrases about so long as they operate in compliance with safety regulations. What we see right now in the restaurant industry is there's so many safety regulations that they're going to drive those folks out of business.
Yeah.
So the health department can layer so many restrictions on the aquatic centers or the gym, fitness centers, et cetera, that they no longer have a viable business model, and they drive them out of business anyway. So the next thing from a legal perspective that has to get worked out is, how long do these restrictions have to stay in place? So the advisement I'm giving to the one committee I've got a voice in, and others, is, all right, you've gotten to phase one out the gate. Most of you have, some haven't yet.
Right.
You got to press on phase two right now, and then figure out what's the full exit strategy. So you got your phase one. Now you got to figure out, and then you got to start pressing the health director and the state of Ohio through your representative, through your senator, through whatever means to the press, things like this tonight. What is the exit strategy? When do we get to decide that we're no longer in a health crisis? And I see the question, Dan. I'll come back to that in a second. But this decision today gives, for the first time, a legal standing to challenge the health director on multiple levels, including the restrictions. We want to get to where Wisconsin's at today, and many other states that never put any restrictions in the first place. Now,
Right.
yeah, how do you deal with it in a safe way? We still have to be responsible. It's no different than and I will draw the flu in from this perspective. The flu is the only thing that we can compare COVID to, because it's an upper respiratory illness, and it's communicable in a similar way. It's communicable through the droplets and so forth, and without getting into all medical. It's different. Don't get me wrong. I'm not saying the flu and COVID are the same. They're not, but they're similar in the fact that they're both communicable. COVID is much more contagious than the flu is, and if you get sick with it, it can be much more devastating. We have to figure out strategies, but this peanut butter approach to the data, the peanut butter approach to businesses, the arbitrary nature of trying to decide, not based on science, but just based on how the team is feeling. I mean, I understand they're trying to do it based upon what's safe and what isn't safe. And they're trying to give the people somewhat of a voice to these business committees. There's no data right now to back up that outside of congregate settings, that there's any true, let's call it fatal spread. Instead of talking about the spread of the virus, we should be talking about the fatal spread of the virus. Where's the fatal spread of the virus at? That's in our nursing homes. Let's put all of our resources there. If you can figure that out, and you're successful in that space, and you can figure out how to deal with the prisons, then maybe as we the people will be more interested in having you get involved in the rest of every single layer of our lives. So I don't know if it. So kudos to the judge. Kudos to the judge in this one, and to the attorneys who put this case together. A very significant case. It's going to help us from the health director being able to arbitrarily take us back into quarantines and arbitrarily take us out. This is going to cause change for sure.
What's so
this is a great question. Larry Schneider just says, Brian, what's your thoughts on being shut back down in a couple months like they say we will have to? What I'm saying is that this particular court case, and this is just one guy spouting off tonight on Ken's show, but what I'm saying, this case provides lawyers, provides our elected representatives. It gives them a legal platform to challenge any arbitrary shutdown of essential versus non-essential. You got to remember, we started this whole thing off. They didn't shut everything down. They declared what was essential and what was non-essential. And so what this case, and I didn't read the parts to it, what it says is that when those decisions were made, there was no true method or vehicle is the wrong word, lever is another word, that they could use to determine if their business was essential to health or not essential to health. There was this challenge committee, but it doesn't pass the sniff test, and it really didn't provide the platform for that. So to your question, this case is very significant in that it should help stop that from happening in the future. Local health departments I will not be surprised if, like in Franklin County, if we see the health department put more strict rules. The governor literally just said this on, what is today, Wednesday? He literally just said this yesterday, that local health districts can put stricter rules down. So watch for that. Yeah, there's a lot to it. A lot to it.
And then you've got the human ego involved, and you've got people, jockeying for variety of positions, and I just think that we got a mess, man.
It's a mess, and the way that we're getting out of it right now in this micromanage thing. I had teenagers, and I made the classic mistakes with my first, just like every parent does, and there were too many rules and regulations. And when you get too many rules and regulations with a teen, they're going to do one of two things. They're going to get depressed, and they're going to just like disengage, or they're going to rebel. And that's what you got going on in the population of the state right now. You got people that are just depressed, and they're just disengaging, and they're just like, well, as long as you send me my check, I'll just keep, drinking my way through this scenario. And then you got other people that are getting more and more, we'll just say, predisposed. That's a bad word. They're headed in the rebellious direction. We don't want people to go in that direction. We want trust, and folks to work together in society and community. So, Sandy, we need to open up businesses. Do you agree? Absolutely. Absolutely. So the why is the question, right? Why? Because the data tells us, the science tells us that it's safe to do that.
Yep.
And that's what we need to be communicating, that it is safe to come out of your houses. It's okay. Does this mean that anybody that people aren't going to get sick, and that people aren't going to get hospitalized, and people aren't going to die? It does not mean that. They never told us that was going to happen. They said we have to flatten the curve so that our hospital systems don't get overrun, so that more people don't end up dying because of lack of availability of quality health care, because of having too many people sick at the same time. Until we reach that moment where we come even close to that, in any situation in our country, the closest we came to that was in New York City. And it was only in certain sections, in certain boroughs. I've got folks down there. It was horrible, absolutely. But it wasn't the entire city, and it definitely wasn't the entire state. And it's the only situation in the entire country where there was a fear that we were going to overrun the healthcare system. So they brought in the ship, the Navy ship. They set up all these temporary hospitals, but they never saw any patients. So bad as it was in New York City, and it was the worst it's been in any place in the country, right? They never overwhelmed the healthcare systems. That's why we shut everything down, and we need to keep coming back to that. Okay, we gave you grace on this idea, and we just want to come back.
14 days.
14 days.
14 days.
That is exactly what the Ohio law says. And now they're going to duke it out in court, and they're going to make different arguments, and we're going to see
so essentially the law says 14 days, but they just keep extending it another 14 days every 14 days.
Well, no, actually they did it first, but then they went in first and they did a 30-day order. And then the last order was another 26 or 30-day order. So they kind of abandoned that particular approach. But anyways, maybe we'll do this some other time. Anybody who actually sat around for 2 hours listening to us jabber, I give you lots of gold stars for those folks.
Yeah, dude, you're awesome, man. Thank you. I appreciate you coming on, and man, this has been.
Yeah, be supportive of our healthcare workers. Be supportive of our nursing home workers. They are a little bit of a forgotten. People talk about frontline workers. I can't imagine anybody more frontline right now than our nursing home workers. And a lot of those folks don't get paid near as much as those in the like a nurse in a traditional hospital setting. I've watched those. I'll call them angels. I've watched those angels handle my grandmother when she went from the step down units into the nursing home and care facilities. They have to put them in full bear hugs to move them from one place to the other, help them go to the bathroom, to help shower and clean them. It's amazing. And they're not getting the support that they need. And hopefully we'll keep drawing attention there, put our efforts there. Let the gyms open. Let people get healthy. I'll leave it at this. I've gained the COVID-19. I don't need this COVID-19.
Yeah. I'm
Thanks
with
for
you,
having me
dude.
on, Ken.
Hey, thank you. I appreciate you, man. And thank you to everybody. Look, sorry, this episode will be.
Right.
Oh, geez. All right. Hey, thanks, dude. I appreciate you coming on. Don't hang up yet. I'm in the live stream. Thank you, guys. Appreciate all of you. And we will see you later. Thanks, Brian.